Start?
Yes, ma'am.
Hello, everyone. Welcome to Auricle Exam Mastery Live classes. I'm Dr. Divya, a live class educator for Auricle. So this exam mastery classes, we are offering you rapid revision of all the important questions, quick revision of the volatile facts, whereas we are also covering the high-yielding topics and most expected questions in the upcoming exams. So this is beneficial for everyone, for all the students of all the universities of different states, as well as for those who are appearing for competitive exams, that is NEET, PG, and FMG exams. So today we will be revising the questions from neuroanatomy, which of these topics, that is the meninges, spinal cord, and cranial nerves. So before we start the class, let's understand some core features of Auricle for those who are new on this platform. So here we offer you live classes as well as recorded classes. So these recorded classes you can access anytime, anywhere. And we also give you the notes, that is CBME-based question and answers, MCQs, and a fun zone for self-assessment. So where you can solve the MCQs as well as enjoy it. So these MCQs are from beginner level to the expert level, and they're all standard multiple choice questions which are asked in the university exams as well as in the competitive exams. So we have 3 subscription plans: the basic, standard, and the mentorship. Mentorship is a 12-month program which we offer you at a special rate of 50,000. So here, including the services which we offer you in basic and standard, we also give you one-to-one personalized guidance as well as notes. You can use the code Dr. Divya 20 for the discount on subscription. Yeah. So we'll start with today's class. So the long essay. So today we'll be dealing with the long essay questions, the short essay, and the short answer questions. So long essay, one of the question is describe the oculomotor nerve under the following headings. That is the origin, course, relations, distribution, and applied anatomy. Okay. So when we talk about any nerves, especially the cranial nerves, we need to write the functional components first. So what are these functional components? So the oculomotor nerve has got 2 functional components, that is the general somatic efferent fibers and general visceral efferent fibers. Okay, so general somatic efferent. So basically when we say general somatic efferent fibers, they basically supply the muscles. Okay, and general visceral efferent fibers, they basically supply the viscera, muscles of the viscera. Okay, so here the general somatic efferent fibers, they arise from the main oculomotor nucleus and they supply the all the extrinsic muscles of the eyeball, including the levator palpebrae superioris. Okay, except 2 muscles, that is lateral rectus and superior oblique, it doesn't supply. So these fibers, that is the general somatic efferent fibers, they form the main component of the oculomotor nerve. General visceral efferent fibers. So basically oculomotor nerve is a motor nerve. Okay, okay, so it is purely motor nerve. So it supplies these extrinsic muscles as well as the viscera, muscles of the viscera. Okay, so general visceral efferent fibers. So these fibers, they arise from the Edinger-Westphal nucleus. Okay, and they pass through the oculomotor nerve and they terminate in the ciliary ganglion. Okay, so the fibers, they begin in the Edinger-Westphal nucleus and they pass through these oculomotor nerve and they relay in the ciliary ganglion. And once they relay, so those fibers which are coming from the Edinger-Westphal, excuse me, will be the preganglionic parasympathetic fibers. Okay, so postganglionic fibers which begin from the ciliary ganglion, they will, through the short ciliary nerves, they supply the sphincter pupillae and the ciliary muscles. Okay, so this is about the 2 components. So coming to the course and distribution, so the oculomotor nerve, Okay, it arises from the medial aspect of the cerebellar peduncle, okay, of the cerebellar peduncle, and it continues. Okay, it continues forwards in the interpeduncular fossa. Interpeduncular fossa, that is okay, between, that is basically that interpeduncular, there is a cistern there which we'll be studying later. So interpeduncular cistern, it's a passes, and between this, if you see here, the posterior cerebral and the superior cerebellar arteries. So between these two arteries, it is passing. Okay. Then it pierces the arachnoid, pia and the arachnoid matter. Okay. After piercing the pia and arachnoid matter, it enters the cavernous sinus. Okay. So it forms, passes through the, basically the lateral wall of the cavernous sinus. So here in the cavernous sinus, okay, it lies above the trochlear nerve. It lies above the trochlear nerve in the lateral wall of the cavernous sinus. So in the anterior part of the cavernous sinus here, it divides into two branches. Here, if you see the upper division and the lower division, it divides, okay? And these both, they enter the intermediate part of the superior orbital fissure. That is the middle part of the superior orbital fissure, which is within the common ring of Zen. Okay, that is tendinous ring of Zen. Okay, so that is the course. Okay, so upper and lower division, we will see the distribution. So this is how it goes. Okay, so it begins in the cerebellar peduncle. Okay, so there. Okay, so it arises from that medial aspect of the cerebellar peduncle and continues forwards in the interpeduncular system between these posterior and superior cerebellar arteries. Okay, pierces the pia and the arachnoid matter. Okay, so when you write the course, you can write it like a flow diagram, one after the where it went next. That is also easier way of writing, and you can write that way. So after it pierces the pia and arachnoid matter, passes through the lateral wall of the cavernous sinus, okay, lying above the trochlear nerve. And in the anterior aspect, it emerges or divides into upper and lower division, passes through the middle part of the superior orbital fissure through the tendinous, that is within the tendinous ring of Zen. Okay, so that is its course. So this nerve, so you can see here, this is the main oculomotor nucleus, that is the somatic component. This is the Edinger-Westphal nucleus, okay, which is the parasympathetic. So we have the general somatic efferent fibers as well as the, okay, visceral efferent fibers. Okay, so the visceral efferent fibers, they pass through the ciliary ganglion here, okay, and through the short ciliary nerves, they will be supplying. So here, if you see the distribution, the main oculomotor nerve, what is it supplying? Supplying the levator palpebrae superioris, superior rectus, medial rectus, inferior rectus, and inferior oblique. Okay, whereas this one, okay, it is supplying the pupil. Okay, that is the ciliary muscles and the pupil. Okay, so here you can see constrictive pupillae it will supply. Okay, so now this is how you can see the two roots coming here, okay, and going. So this is the dilator pupillae, constrictor pupillae. So the constrictor pupillae is supplied by the Edinger-Westphal. Through the Edinger-Westphal, that is this general visceral efferent fibers will supply. Okay, so we will see in this table. So you can write after explaining the distribution, you can write about its division, functional components, and the distribution, making a column. That is the easier way and better way of representing the answer. So we have the upper and lower divisions. So each division will be carrying both the general somatic efferent and general visceral efferent fibers. So superior rectus gets general somatic efferent fibers. Levator palpebrae superioris is supplied by both general somatic efferent and general visceral efferent. Dilator pupillae is supplied by general visceral efferent. Okay. The lower, the general somatic efferent fibers, they supply inferior oblique, inferior rectus, and medial rectus. General visceral efferent supplies the constrictor pupillae and the ciliary muscles. Okay, so those are the functional components. Next, you have to write about the oculomotor. Okay, so you can draw these diagrams, okay, showing the nuclei. This pathway diagram, if you're able to draw, it's well and good. Otherwise, you can draw this diagram with these schematic representation of its supply. Okay, and you can finally always anatomy answer should be end with applied anatomy. So in oculomotor nerve palsy, okay, so here when the nerve is involved, what happens is the eye is fixed, okay, the eye will be fixed in lateral and downward, okay, if you see here, the eye is fixed in lateral and downward position, okay, that is known as the lateral squint or strabismus. Why? Because the lateral, there is unopposed action of the lateral rectus and superior oblique, because those two muscles, they bring about the lateral rotation, understand? And those two muscles, they are not supplied by the oculomotor nerve. So that is why they have unopposed action there. So they are intact, and because of their action, the eye is deviated towards the lateral side and it is fixed there. Then the pupil is dilated because of the unopposed action of dilator pupillae. So dilator pupillae is supplied by the sympathetic fibers, okay? So, which are accompanying the nasociliary branch of the ophthalmic nerve. So because of that, the pupil here is dilated because there is no constrictor action, right? And the upper eyelid will droop down. Okay, upper eyelid, if you see, it will be drooping down because of the paralysis of levator palpebrae superioris. So when you know what muscles it is supplying and you know what action of these muscles are, so to write the applied anatomy, it becomes easier. Okay, so the next question is, describe the facial nerve under the following headings. Okay, so the origin, course, relations, distributions, and applied anatomy of the facial nerve. Okay, so facial nerve, the functional components. Okay, so it has got actually 4 functional components. So one is the special visceral efferent. Okay, special visceral efferent fibers. Now, so where do these special visceral efferent fibers arise? They arise from the motor nucleus. Okay, so the special visceral, when we say, they basically supply the muscles which are derived from the branchial apparatus. Okay, so they are supplying the muscles which are derived from the mesoderm of the second pharyngeal arch. So that is basically the muscles of facial expression. Okay, the posterior bed of the digastric. So all those muscles are supplied by that. Then we have the general visceral efferent. Okay, these fibers, they are preganglionic parasympathetic fibers. Okay, and they go to the pterygopalatine and to the submandibular ganglia. So pterygopalatine ganglion, through that it will supply the lacrimal gland. Submandibular, it will for the salivation, for the saliva, it's a salivary gland. Now these fibers, that is the the preganglionic fibers, they come from the lacrimatory. Okay, you can see here, there is the lacrimatory nucleus as well as the superior salivatory nucleus. So all these fibers are coming here. Okay, so this is the motor nucleus. This purple thing, well, is the motor nucleus. So from this motor nucleus, we have the special visceral efferent fibers. Okay, then from the general visceral efferent, we have the general visceral efferent fibers are coming from the lacrimatory and the superior salivatory nucleus. They will be together here. And then the preganglionic fibers arising from the lacrimatory nucleus will terminate in the pterygopalatine ganglion. Okay, after that, the postganglionic fibers will begin in the pterygopalatine ganglion. Excuse me. And they will be supplying the lacrimal gland, okay, mainly the lacrimal gland through the zygomatic branch of the trigeminal nerve. Then we have the preganglionic fibers, which are beginning from the superior salivatory nucleus. So they go to the, which one? The submandibular ganglion, okay? And from there, the postganglionic fibers will begin and they supply both the submandibular as well as the sublingual glands. Then we have the special visceral afferent column, okay, afferent. So these afferents are basically the sensory fibers. So they are concerned, special visceral. So they are concerned with the taste sensations, okay. So here what happens, the cell bodies of these fibers, they will be present in the geniculate ganglia. So the peripheral process means now its sensations, they are coming back, right? So they begin where? That is, they carry the taste sensations from the anterior 2/3 of the tongue, except for the circumvallate papillae, okay? because they are supplied by the glossopharyngeal. So they carry the taste sensations from the anterior 2/3 of the tongue, and they go to this, that is to the upper part of the nucleus of Tractus solitarius. Okay, and the central process from this ganglion cells. Okay, so the cell body is located where? In the geniculate ganglion. Okay, so the peripheral fibers are bringing there, and from there the central process. Okay, so that will take it to the nucleus Tractus solitarius. Then we have general somatic afferent fibers. Okay, so these cell bodies are also located in the geniculate ganglion. Now, what are they supplying? General somatic afferent. So the peripheral processes, they innervate the skin. Okay, that is of the external ear, while the central processes, they will be terminating in the spinal ear, spinal nucleus. So if you see, it comes here and ends up in the spinal nucleus of the trigeminal nerve. Okay, so coming to its course and relations, okay, course and distribution. So the facial nerve, if you see, it has got two roots. Okay, so the motor root is there and the sensory root is there. Okay, sensory. So where do they arise? They begin in the ventral aspect of the brain stem. Okay, that is at the pontomedullary, that is lower part of the pons. It begins. Okay, so at the pontomedullary junction, it begins. That is where the pons and the groove between the olive and the inferior cerebellar peduncle is there. No, there it arises. So here, the main trunk, that is the motor root, it will enter the here. Okay, it is entering the internal auditory meatus. Okay, it enters the internal auditory meatus, which is accompanied by the smaller sensory root. Okay, so it will be accompanied by the sensory root, and both will enter the internal auditory meatus. Okay, and along with that, the vestibulocochlear nerve will be there, as well as the labyrinthine vessels will be there. So at the lateral end of this internal auditory meatus, these two roots, okay, both the roots will unite and they form the trunk of the facial nerve. Okay, form the trunk of the facial. So for here, what happens is it will run first. Okay, so where it will first run above the bony labyrinth of the internal ear, and then it will bend forward. Okay, it forms the forming the genu of the facial nerve. And then after that, it runs posteriorly in the medial wall. Okay, that is the wall of the internal ear. Sorry, the middle ear. Okay, medial wall of the. So there it will have an oblique course. And after that, it runs straight. That is forming a part of the posterior wall of the in the posterior wall of the middle ear. Okay, middle ear cavity. So it forms a part of the medial wall as well as forms a part of the posterior wall. Okay, so it will run posteriorly in the middle ear, in the medial wall. Okay, and then it turns 90 degree and it runs down. Okay, so this portion will be actually in the medial wall, and this portion will be in the posterior wall. Okay, of the middle ear. Then it turns. So here, if you see, it turns 90 degree and it emerges. Okay. So, and it reaches where? It reaches the stylomastoid foramen. So till then, it goes down like this, stylomastoid foramen. Okay. So once it reaches the stylomastoid foramen, okay, the motor root. So if you see, the motor root is coming out from here. Okay. So the motor root will come out from that stylomastoid foramen. And from there, it will pierce this posterior wall of the parotid gland, and then it emerges, divides into its 5 branches, and it will supply the face. Okay, so that is how it terminates the motor part. So the facial nerve here, if we see, okay, the branches when we see, so once it comes here, okay, it has the sensory ear. So first it gives the greater petrosal nerve. Okay, so this is given where? This is given within the middle ear. Okay, so greater petrosal nerve. So greater petrosal nerve will pierce the roof of the middle ear cavity. Okay, it pierces the roof of the middle ear cavity, and then it will pass through the nerve of the pterygoid canal. Okay, it will actually it is joined by the deep petrosal nerve, where it will form the nerve of the, so the greater petrosal nerve is joined by the deep petrosal nerve, forms the nerve of the pterygoid canal. Okay, then from there it enters this pterygopalatine ganglion, and the postganglionic fibers, they will be supplying the lacrimal, the nasal, as well as the palatal glands. So that is through this one. Then we have the nerve to stapedius. Okay, so in the posterior wall, as it is coming down, it will supply the muscle, that is nerve to stapedius. Okay, and then as we come down here, also in the middle ear cavity only, it will give, that is, we will see it in the lateral wall of the middle ear, we'll see the chorda tympani nerve. Okay, chorda tympani nerve, and chorda tympani nerve is joined by lingual nerve. So basically, chorda tympani nerve, what does it do? It carries the taste sensations, isn't it? Taste sensations from the anterior two-thirds of the tongue, and it provides also this ganglionic fibers, that is preganglionic fibers, to the submandibular ganglion, that is through the lingual. Okay, and then we have after that the posterior. So still as we come down here, we have the posterior auricular nerve. Okay, posterior auricular nerve. So posterior auricular nerve will supply the occipitalis muscle. Okay, and the posterior auricular muscles it supplies. Okay, and then it comes out here of the stylomastoid foramen, and from there it is giving which one? Nerve of to the posterior belly of digastric, as well as to the stylohyoid muscle, because all these muscles, they derive from the second pharyngeal arch. Okay, so the chorda tympani nerve passes through the pterygopalatine fossa and comes here. Okay, and then we have its terminal branches, that is temporal, zygomatic, buccal, mandibular, and cervical. So these are its branches. So when you know the course of the nerve, okay, it is easier to talk about its branches also. Okay, then this diagram seems easier when you understand the course of it. Okay, so the entire course, what we are talking here, it enters the internal auditory meatus. Once it enters, all these nerves begin, okay, within the cavity of the middle ear. Right. So next is the applied anatomy. So applied anatomy in facial nerve lesions, we have two kinds. One is the upper motor neuron and one is the lower motor neuron. Lower motor neuron, we call it as the Bell's palsy. So here what happens in upper motor neuron and lower motor neuron. Okay, so upper motor neuron, we also call it as supranuclear, whereas lower motor neuron, we call it as infranuclear. Okay, so now if you see, okay, so this, the fibers, okay, they are beginning where the motor nerve fibers, they are beginning in the cerebral cortex, isn't it? They are the corticonuclear fibers. So usually these corticonuclear fibers, no, they cross. Okay, where they cross now, these are the corticonuclear. Okay, so they are coming from the cortex to the nucleus of the facial nerve. So before it reaches the nucleus of the facial nerve, what it does is it crosses. But few of the fibers, just like we have the corticospinal tract, right, or the pyramidal tract, that also some fibers cross, some fibers do not cross, isn't it? The ones which cross forms the lateral corticospinal tract, whereas the which doesn't cross forms the anterior. So similarly here also, the corticonuclear fibers, they cross. Okay, most of them cross, but few of them do not cross. They go to the same side. Okay, now once they cross, what happens? Now this one is the right side, one is the left side, isn't it? So the left side supplies the left side of the, so the nerve which emerges from the left facial nerve nucleus supplies the left side, and which emerges from the right supplies the right side. Okay, so now if the lesion, upper motor neuron lesion means what? As the nerve says, it's, as the name says, it is supranuclear. So before it comes to the nucleus. So here now the left fibers, there is a lesion here, upper motor neuron. Okay, so anywhere during its pathway, before it reaches the nucleus, there is a lesion. So in this case, what happens? Now, most of the fibers here, they are crossed to the opposite side, isn't it? Okay, so which side will be affected? Because these fibers, they cross. So the right half of the face should be affected, isn't it? Right half of the face should be affected. But if you see the features here in upper motor neuron, only the lower half of the face is affected. Okay, lower half is affected and not the upper half. Now, why is it so? It is so because the upper half of the face is usually supplied by the same side fibers. Okay, so it will have dual supply, that is from the opposite side fibers as well as the same side fibers. Okay, so since the right side fibers are also that is the corticonuclear fibers, they supply the upper part of the face. Okay, so those fibers here, so that is why the upper half of the face will be spared. Okay, upper half of the face is spared. Only the lower half is affected. Okay, so the upper half is supplied by fibers from, so you should remember it is supplied by fibers from both the sides. Okay, so that is why in the here the nerve which is coming, okay, so the facial nerve which is coming now after the nucleus begins, right? So it will have fibers of the same side. So the same side fibers are not affected. So that is why the upper half of the face is spared, okay? Now if it is infranuclear is after the nerve begins, that is the facial nerve begins after from the nucleus. Now this has got the same side fibers as well as opposite fibers, okay, and it is affected here. So what happens? The entire half of the face will be affected in lower motor neuron. Understand? So entire half of the face is affected. Okay, so next is the subarachnoid system. So here, short essay question. So what do we write for subarachnoid system? So definition, the location, function, and applied aspects. So what is the definition? Now the subarachnoid space, okay, that is below the arachnoid matter, it presents dilatations, okay, dilatations which are filled with a large amount of, because there are a dilated space there, it is filled with substantial amount of CSF, which is called as the subarachnoid cisterns. Okay, so they are basically the spaces, they are dilated spaces, subarachnoid spaces, which are filled with CSF. That is called as subarachnoid cisterns. So they are a large pool of CSF and they act as a waterbed to the brain. So here what you can do is you can make 3 or 4 columns and you can write the answer. So cistern, where it is located and the formation of it and what it contains. Okay. So first is the cerebromedullary cistern. So this is the largest cistern. Okay. So it lies in the angle formed by the cerebellum. Okay. It lies, this is the cerebromedullary cistern. It is also called as cisterna magna. So this is the largest cistern. Okay. So this lies in the angle formed by the cerebellum. So this is the cerebellum and this is the medulla oblongata. And here down will be the occipital bone. So that is the cerebellomedullary cistern. Okay, it's the largest cistern. So it is formed by the arachnoid matter bridging this gap between the medulla oblongata and the inferior surface of the cerebellum. Now this space, this is the only cistern which will be communicating to the foramina of Lashka as well as the Magendie. Okay. The next cistern we have is the pontine cistern. Okay, so pontine cistern is here. So it is continuous below with the subarachnoid space of the spinal cord. Okay, behind with the cerebromedullary cistern. So here it will be continuous. Okay, and rostrally with the that is interpeduncular cistern. So this is where it is. It is in the this one. What is that? Ventral surface of the pons and contains. Okay, so it is basically located in the ventral surface of the pons and it contains the basilar artery and its branches. Okay, so the content is basilar artery and its branches. Then the interpeduncular cistern. So we saw like the oculomotor now going that side, right? We studied earlier. So interpeduncular cistern is here. So it is continuous laterally with the subarachnoid spaces. Okay, and subarachnoid spaces surrounding the middle and posterior cerebral arteries. And anteriorly, it is with the subarachnoid space around the anterior cerebral. Okay, so laterally with the subarachnoid space around that posterior and middle cerebral, and anteriorly with the subarachnoid space around the anterior cerebral. That is the interpeduncular cistern here. So it is formed by the arachnoid matter bridging the two temporal lobes, and it contains the circle of Willis. Circle of Willis is present there, okay? Then we have the cistern of lateral sulcus, or for Sylvian cistern. Okay, Sylvian cistern, it is in the stem of the lateral sulcus. Okay, stem of the lateral sulcus, in front of the temporal lobe it will be present. So it is formed by the arachnoid matter bridging the lateral sulcus. So here the content is the middle cerebral artery. Then here we have one more, that is the cistern of great cerebral vein, or cisterna superior. It's called cisterna, or cisterna ambiens it's called. So in this portion, okay, so it is the interval between the splenium. Okay, that will be the splenium of corpus. This is the splenium of corpus callosum and superior surface of the cerebellum. So this part we have the which one? The cistern of great cerebral vein. So this contains the, as the name itself says, it has the great cerebral vein as well as this gland is present there. That is the pineal gland. Okay. Then you write about the applied aspects. So it acts as a water bed, okay, to the brain, and the cerebellomedullary cistern is easily accessible. Okay, this is easily accessible to a needle. Okay, so we can, through the foramen magnum, no, we can go here. Okay, so usually that suboccipital triangle, no, we go to this cerebromedullary cistern. So usually when CSF cannot be drawn, like a lumbar puncture is not possible, in that case, CSF is drawn from this space. Okay. Then we have the cistern of great cerebral vein. No, since it contains the great cerebral vein as pineal gland, it is used as a neurosurgical landmark. Next is you have to draw a neat label diagram of cross-section of spinal cord at the mid-thoracic level showing ascending and descending tracts. And you have to explain the functional importance of the dorsal columns. Okay. So now, when we say dorsal columns, so basically the posterior columns. Okay. So the posterior column is usually, they are the sensory. So you draw the diagram like this, showing, you can show the anterior tracts, that is the descending tracts, the descending tracts on one side, whereas the ascending tracts on one side. Okay. So here we, as the question is concentrating on ascending tracts, so we have this. This is the anterior horn. This is the posterior horn. Okay. This is the anterior median fissure here. This is the posterior median sulcus. So these are the ascending tracts we see. That is the anterior spinothalamic, lateral spinothalamic. This is spino-olivary. We have the anterior and posterior spinocerebellar. And here we have the fasciculus cuneatus and fasciculus gracilis. Fasciculus also means tract, okay, tract. So here the lateral spinothalamic tract, so location is lateral white column. Origin begins in the posterior horn cells of the spinal cord of the opposite side. Okay, and it terminates where? In the ventroposterolateral nucleus of thalamus. So why is lateral spinothalamic tract important? It carries the pain and temperature sensations of the opposite half of the body. Okay, anterior spinothalamic located in the anterior white column, and it ends, origin is in the posterior horn of the spinal cord of the opposite side, and it ends in the ventroposterolateral nucleus of the thalamus. Okay. And it carries the light touch. So this one, anterior spinal light touch, pressure and vibration sensations and all it carries, okay, from the opposite half of the body. Then we have spinotectal tract, begins in the lateral white column, so location is the lateral white column, begins in the posterior horn of the spinal cord, okay. So all they are from the posterior horn, okay. And it ends in the superior colliculus, spinotectal, okay. So superior colliculus of the tectum of midbrain. So basically this is responsible for visuomotor. That is, with the movements, we change the position of our head and neck, isn't it? So that is concerned with spinotectal tract. Then we have spinocerebellar, anterior and posterior. So it's in the lateral white column. Okay, so origin is in the posterior horn of the spinal cord, the same side. Okay, so they go in the same side. So ends in the cerebellum. So basically unconscious kinesthesia, it is proprioceptive sensations it carries. Fasciculus gracilis and cuneatus, they are in the posterior wide column of the spinal cord, begins in the dorsal root ganglia of the spinal nerves of the same side, okay? And ends in nucleus gracilis and cuneatus of the medulla. So they carry the joint sensation, vibration sensation, two-point discrimination, stereognosis, okay, and conscious kinesthesia sensations are carried by that. Okay, next question, short answer question. Short answer, the question is enumerate the cranial nerve nuclei which are taking origin from the medulla oblongata. Okay, so they are the last four cranial nerves. Now this is, here we see this is the medulla. Okay, so the glossopharyngeal nerve. So here between the olive and the inferior cerebellar peduncle, we have the glossopharyngeal, the vagus, and the cranial. Root of accessory, it comes there. Okay, and okay, so you have to, can mention cranial accessory now. And here, cranial part of the accessory nerve, okay? And between the pyramid and the olive, we have the hypoglossal nerve. So this is the hypoglossal nerve. So these are the four cranial nerves. So the question is enumerate. You don't have to explain anything. You just have to mention. You can mention at the max, you can mention the site, that is glossopharyngeal, vagus, and you just list it out, and after that you can write the glossopharyngeal, vagus, and the cranial part of accessory emerges between the olive and the inferior cerebellar peduncle, whereas hypoglossal nerve emerges between the pyramid and the olive. Okay. So the question is cauda tympani nerve. What are the structures supplied by it? Okay. So what is this cauda tympani nerve? So cauda tympani nerve, we already learned it is a branch of the facial nerve, isn't it? So it carries the sensory and parasympathetic fibers to the lingual. So the nerve pathway, so where it begins? So nerve begins, in the, so here you can see the cauda tympani nerve here. It emerges through the posterior canaliculus of the this thing. Okay, that is, this is the posterior wall of the middle ear cavity. So here it begins. Okay, it crosses across the lateral wall, passes through the pterygotympanic fissure, enters the pterygopalatine fossa. Okay, and from there it will be joining the lingual nerve, then supplies, like, basically it will be carrying the fibers. So when we are talking about the pathway, we talk it that way. Okay. So here the question is very specifically, what are the structures supplied by it? Okay. So what are the structures supplied by it? So if you see, so sensory fibers. So what sensation? Special sensations. Okay. So it carries the taste sensations from the anterior 2/3 of the tongue, except for the circumvallate papillae, as well as it also carries the sensations from the soft palate. Okay. The parasympathetic, that is the preganglionic fibers. So they go here to the submandibular ganglion. Okay, submandibular. And then the postganglionic fibers will supply the submandibular as well as the, so it goes to the submandibular glands, so submandibular ganglion, and the postganglionic fibers will supply both, that is the submandibular as well as the sublingual gland. Okay. Then the secretory fibers, that is secretory fibers basically for this submandibular and sublingual gland, and vasodilators fibers through the submandibular ganglion it supplies. So these are the structures supplied by it, or the sensations which the cauda tympani nerve carries. Next, the question is hypoglossal nerve. So here for cauda tympani, you just have to mention, okay, what are the things it carries, okay? So basically one will be the sensory, another one will be the parasympathetic. Parasympathetic, both for the secretory function as well as for the vasodilator, it carries, okay? So hypoglossal nerve now begins where? So it begins in the medulla, right? So this is the hypoglossal. So between the pyramid and the olive, the nerve is emerging. Right. So what is the question? Its branches are asked. Okay. So what are the structures supplied by the hypoglossal nerve? So hypoglossal nerve is purely a motor nerve. Okay, so what does it supply? So it emerges from the hypoglossal canal. Okay, it crosses across. Here we have the internal and external carotid. Here it crosses and it supplies all the muscles of the tongue. Okay, so if you see here, it is giving nerve to thyroid. Okay, nerve to the thyroid. Then it is supplying the styloglossus muscle, then all the genioglossus, hyoglossus, okay, palatoglossus, all the muscles it supplies. Okay, as well as it also gives, it forms, the joins with the C1 nerve, okay, C1 nerve, and it forms the superior root of the ansa cervicalis. Okay, so that is known as the descendants hypoglycemia. Through that, it also supplies the three muscles, that is the inferior belly of omohyoid, then sternohyoid, sternothyroid. Okay, superior belly is supplied by the superior root of this ansa cervicalis. So these are the branches of the hypoglossal nerve. Okay, so oh, this is somewhere wrong here. This is not involved here. This is for the recent. Okay. So with this, we complete today's revision classes. Thanks for watching Auricle. So for more contents, you can follow the social media handles on YouTube, Instagram, Facebook, and Telegram. And if you haven't yet downloaded the app, you can start your journey with Auricle by downloading the app right away on Google Play and App Store. So until then, next time.